Can you hear me now? Thank you. Well, thank you so much for inviting me here. It's a pleasure to be back in Kingston. It's unfortunate that it was a genocide that brought me back, but it is, I'm quite happy to see so many familiar faces. I want first to acknowledge that I am a settler on land that hasn't been colonized. And as I'm about to speak about Palestine, which is another occupied land, I think it's important that I acknowledge that. I also think it's important to acknowledge that I am not Palestinian. I am a white male, and for that reason, I have had the amazing good fortune of being able to go to Palestine since 2013. Not only Gaza, but also West Bank. There are people here in this audience today who are Palestinian who cannot go to Gaza and West Bank. So some would say I'm the most fortunate person here today, and I would agree with that. This picture is actually the beach in Gaza City. And people in Gaza will always tell you there is always sun. There's always sun in Gaza. And that is a reflection of the hope. Today I want to talk to you about my experiences providing humanitarian aid there since 2013. I understand that there has been some interest in the fact that I had death threats and was suspended from my job and all the rest. I am happy to talk about that, but for reasons of ongoing legal issues, that will not be recorded, and that will come after, if we have enough time. Okay? So I started going to Gaza in 2013, and the first time I went was part of a delegation of doctors interested in how to enhance the healthcare system and how to enhance spending after widespread Israeli bombings in 2012 devastated much of the infrastructure. I spent an entire month there, spent time with the health officials, visiting all the health officials and all the health facilities. And after this, I wrote a report that had 60-some recommendations that was sent to the World Health Organization, the health officials in Gaza. I returned to Canada, and I waited, and I waited, and I waited, and nothing happened. And in large part, that was because most of the donations that were promised from international actors were not provided. And that report sat on a desk, and nothing happened. However, I did meet this man on the right, and that's Dr. Farwan. He at the time was the dean of the medical school at Islamic University of Gaza, where I've been teaching internal medicine and nephrology since 2015. He and his wife were killed in Israeli airstrike in November. His wife was also a physician. Now, when I left that first trip, it was transformation. I had been to Indigenous communities in Canada providing aid. I've been to Uganda several times. But I hadn't seen occupation. And I use that word because every valid human rights organization on earth calls this an illegal occupation. And as the occupying power, Israel has certain responsibilities. Under international humanitarian law. However, even prior to October 2023, I want to provide you with some context. I'll give you some of that today. The withholding of electricity, water, food, prevention of self-determination of the Palestinian people, that did not start in the last 6 months. That preceded October 2023. And that is a form of collective punishment of the civilian population of Gaza. Now, when I was in Gaza for the first time, I met this man on the left. Can you see? I don't know if you can see, it's really bright. Okay. I met this man on the left. His name is Ahmed. And for the sake of simplicity today, to maintain some form of anonymity for some people in Gaza, you will notice a striking similarity of the names of all male and females that I talk about in this talk, in large part because there are some details I've intentionally withheld for the sake of maintaining their security. Over the years, this gentleman and I became friends. I met him on a very warm day initially in Gaza City, in Shifa Hospital, in the dialysis unit actually. He immediately noticed, I don't look like a local. So he came up to me, he was trying to practice his English, and by the end of our long chat, We were laughing, we hugged, we actually exchanged WhatsApp numbers. Our friendship begun. And you can probably see in the picture though, there's something a little bit unusual. I mentioned it was a very warm day, but he's wearing a winter coat. And the reason he's wearing a winter coat in the hottest time in Gaza is that in 2008, he was a victim of Israel's use of white phosphorus in a densely populated area in Gaza. So he had been admitted to the intensive care unit for a long period of time at Shifa Hospital with extensive burns to his torso, his arms, his upper legs. He was in the intensive care unit for weeks. Even after the violence ended, in early 2009, there were electricity blackouts in the hospital. And if you're imagining being on a mechanical ventilator in an intensive care unit, what happens when the electricity goes out? Well, you hope the backup generators kick in, right? If the backup generators kick in, the mechanical ventilator continues to work. It just so happened that at that time, there was a deficiency of fuel. And so intermittently, when the power went out, the generators would not turn on. What does that mean to someone on a mechanical ventilator? Well, lucky for him, his mother was by his bedside the entire time. So when the power went out, if the backup generators didn't kick in, she would physically disconnect his ventilator, attach an oxygen bag, squeeze, and she would do that until the backup generators went on. Sometimes that took minutes, sometimes that was even a couple hours. In one case, his mother did that for 2 hours. And when the backup generators went on, everyone in the intensive care unit, except him, was dead. That was the inspiration behind the Empower Gaza campaign, in which we fundraised for solar energy systems for as many hospitals as we could fundraise in Gaza. Now, I watched since October, in addition to withholding fuel, those solar energy systems have been targeted and destroyed, often before the rest of the hospitals. More about Ahmed. Well, he became a friend. He was a patient in the dialysis unit, so every time I'd go to Gaza, I would see him. His mother would bring me falafel when I sat with him in the dialysis unit. And when I went to Gaza in September of 2023, I actually noticed that he had stopped responding to his WhatsApp messages, and it looked like he actually wasn't even receiving them. So I went to the dialysis unit when I was there in September, and he wasn't there. One of the doctors told me that he had actually died from COVID-19. That was sadly the fate of many people in Gaza during the pandemic. As the occupying power, under the Geneva Convention, Israel must ensure public health standards, provision of food, and medical care to the population under occupation. And yet Israel was widely used as a model of early vaccination within Israel. And yet the occupied territories for which Israel is responsible had late and inadequate access to vaccination. About 10 to 15% of the population in Gaza had access to the Russian Sputnik vaccine, which was donated, but the overwhelming majority of people who did receive vaccination was late or did not receive vaccination at all. So the exact death toll in Gaza from COVID-19 isn't well known. So every year I've taught the nephrology curriculum at the Islamic University of Gaza since 2015. Part of that involves clinical rotations in hospital, teaching medical students and residents. This is a picture which is not very different from what we would see in Canadian hospitals on the left-hand side. On the far left of that picture is Dr. Ayman. He's on rounds in Shifa Hospital, in Gaza City. With him are some medical students and an internal medicine resident. And Dr. Ayman, in this picture from 2018, was the head of internal medicine at Shifa Hospital. And when I would go, I would do rounds with him. He and I would take turns teaching the residents on rounds. He was killed in an Israeli airstrike in 2019. On the same day that he was killed, the Ministry of Health building in Gaza was also struck. The clinic immediately adjacent to it was also destroyed. In that clinic was where all the HIV, hepatitis B, hepatitis C, and COVID-19 testing was done. So for weeks, there was no testing done for any of these conditions. So the Ministry of Health in Gaza had to make the horrific decision between transfusing blood that could be infected versus letting bombed victims bleed to death. And I would like to say that is rare, but those types of decisions at baseline happen all the time. That is a reality of the Dr. Ayman, I mentioned he was killed in an Israeli airstrike. The man that replaced him as the head of internal medicine at Shippa Hospital is here on the picture on the right-hand side, on the left of the table, okay? That's me on the right, and that's Dr. El-Kashif in the middle. He's the head of the Palestine Medical Council. The reason we were meeting, this was in September 2023, because we are making the final steps to entrench a nephrology board certification program so that Gaza could train its own nephrologists, its own kidney doctors. We're also developing an international curriculum for internal medicine. Since this picture, the nephrologist who was to lead that is Dr. Hammam Alov. He was killed in an Israeli airstrike in this home. His father-in-law were also killed. Dr. Rafat Labad, a week later, his house was struck and he was killed. So going to Gaza since 2013 has also given me the opportunity to engage in a lot of clinical work. Perhaps the most relevant clinical work to discuss today is the violations of international law that I witnessed in 2019 when I worked as a medic at the March of Return, the Great March of Return. And this is a picture that indicates really hundreds of Palestinians from all walks of life were part of this demonstration. Children, adults, men, women, Christian, Muslim, able-bodied, people in wheelchairs, everyone came. It was truly a beautiful event. And they walked along the separation wall between Gaza and Israel, demanding that Palestinian refugees be allowed to return to the lands from which they were forcibly displaced. This right of return enshrined in international law under the 1948 Universal Declaration of Human Rights and the Fourth Geneva Convention, but not ever enjoyed by Palestinians living in Gaza. So as a medic at the Great March of Return, I considered myself fairly experienced. I started a first aid team in my undergraduate. I had taken additional courses in trauma and advanced cardiac life support. But despite this world-class training, I wasn't trained to respond to war crimes. I arrived early to meet my team members. We worked in a group of 4, 2 physicians and 2 paramedics. Here I meet 2 of my team members before we get into uniform and look at our packs to figure out the logistics. The first wave of gunshots was from snipers. 75 meters away, a young man had been shot. My team of 4 responders ran to him. One of his friends was yelling his name. This young man had been shot on the right side of the chest. The bullet exit wound, I could see it at the back. There wasn't a lot of external bleeding, but he was in shock. So our team of 4 picked him up and ran with him to the trauma stabilization point, where they had additional medical care available. By the time our team returned to the demonstration area, the sniper fire had intensified, and there were intermittent bursts of machine gun fire. There were not a single gun on the Gaza side. The only weapons they had were Palestinian flags. A boy, about 15 years old, started running towards me in one of these waves of machine gun fire. The boy stopped, he bent over, and then he stood up again, I think probably to tie his shoe. He was about 30 meters from me. And when he stood up, he was shot in the head. By the time he fell to the ground, his eyes and nose were open. He wasn't. I told my team, go to the woman. Because he was not survivable. There was a woman who had been shot, who was a healthcare worker, wearing a lab coat. I later learned that she was actually one of my first medical students. So I applied the tourniquet to this young woman's leg, and she was small, so two of us were able to carry her to trauma stabilization point. And then we returned. And the other two went to the young man who had been shot. These protests continued for hours. Bursts of Israeli machine gun fire spraying bullets across peaceful protesters. Sniper shots as well. And you can see the snipers. If you look in this picture, you can see where the snipers were. In the middle of this picture, there's a mound of dirt. That's where the snipers were. You could see them. So my team of 4 worked to provide first aid in the protest area, then to carry shot protesters to the ambulance or trauma stabilization area. And this continued for hours. I recognized, as soon as I got home, these were war crimes that I witnessed. So I contacted Thomson, who at the time was the judge in charge of the International Criminal Court investigation. And I provided testimony to the ICC, and they provided me this letter thanking me for providing testimony. But their investigation found, and I'll quote, the commission has reasonable grounds to believe that during the Great March of Return, Israeli soldiers committed violations of international human rights and humanitarian law, intentionally shooting at journalists, health workers, children, persons with disabilities, knowing they were clearly identifiable as such. Now, those words didn't surprise me because I saw it with my own eyes. That was the first time I provided testimony to the ICC. I've done it 3 times since, and I'm supposed to meet with them again in a couple of months' time with regards to things I saw in March. Now, that provides a little bit of context of what was happening in Gaza before October 2023. The majority of the population was under the poverty line. More than half of children were either malnourished or suffering from anemia. Rates of blood cancer were higher than any other part of the Middle East. The reasons aren't clear, but it's thought possibly related to exposure to white phosphorus and other chemical weapons. More than half of the population, food insecure. Within hospitals, shortages of medications and supplies was a daily reality. A third of the World Health Organization essential medications were non-existent in Gaza as of October 1st of 2023. Now, all of this, what does it indicate? It indicates that Israel has not fulfilled its responsibility as the occupying power. So it was in this context of seeing war crimes with my own eyes, recognizing the impact that the illegal Israeli occupation had on Gaza, a humanitarian crisis at baseline, an effect that many have called a slow genocide before October. So I presented the general internal medicine and nephrology curriculums in September. And you'll notice this picture, there's 4 women. These are actually the class representatives of the Islamic University of Gaza class. All women. Sadly, since that photograph was taken, this is now what the Islamic University of Gaza looks like. Completely destroyed. Okay? So those medical students have nowhere to study. And the hospitals where they would have done their rotations have been destroyed in an act of scholasticism. There are 2 medical schools in Gaza. This is the second one, Al-Azhar University, also destroyed as a result of Israel bombings on October 11th. November 4th, and November 21st. Gaza University and the other universities. I can show you pictures of those two. So they look the same. Destroyed. This is a medical student I met in March of this year. We were working together in a clinic in Rafah. She was studying at the Islamic University of Gaza. Her name is Reed, and she's a fourth-year medical student. She was living in northern Gaza. She and her family were displaced 4 times until they finally arrived at this UN shelter in Rafah, where she, both of her parents, and her 3 younger siblings now live in what used to be the library of this UN shelter. And yet she's smiling. She was volunteering in a wound care clinic, and I asked her, how's your family doing? Bad question. Even asking, how are you in Gaza? Bad question. And she said, we're still alive. We're together. For this reason, we're lucky in Gaza. I said to her, what can I give you? What do you need? Please, food, anything. And she said, I'm fasting. You're not fasting. I should be giving you food. I actually was fasting, but she didn't know. And now she's trying to get her family out of Gaza. She has no medical school to go to, no discernible hospital to work at, even if she was able to get to medical school. And that's the story of every medical student in Gaza. This family I met in March. They came from northern Gaza with nothing but each other and the clothes on their back. And the man on the left was an engineer. On the right, a pharmacist, Basma. They had a house actually close to the Indonesian hospital in northern Gaza. And when the Indonesian hospital was under siege and getting bombed, they left. And so they don't actually know if their house has been bombed. At some point, they want to go back. At some point, when it's safe to return, if it's safe to return. It may never be safe to return. This is the tent city in Rafah. This is the area that Ahmed and Basma moved to. This area was meant to accommodate 1.5 million people who were displaced in different parts of Gaza. The area has 1 toilet for every 1,500 people, and I've shown it on the right-hand side. It's a cement block. The toilet area has no doors for privacy. There's also nowhere to put garbage, nowhere to shower, except the sea. As we speak, the people in Rafah have been ordered to evacuate, and they've been ordered to go here. So there's already a humanitarian crisis here, and they're about to have another 500,000 people displaced to that location. The density of people in the camps is exceptional. At baseline, Gaza is one of the most densely populated places on Earth. Now, 70% of the population is in a tiny slice of Gaza Strip without sanitation, clean water, food. People are desperate. People are hungry. Infectious diseases like hepatitis A, respiratory outbreaks, diarrheal illness are rampant. Now, part of the WHO assessment I was tasked to do when I was there was to establish medication supplies in different healthcare centers. I saw a 20-year-old man with cerebral palsy. He died because he couldn't get access to the seizure medication. I saw a 17-year-old girl die from pneumonia. Would be easily treated, except the place where she showed up had no antibiotics. Her parents begged me to save her. What could I do? I hugged the father. That's all I could offer. Perhaps the most difficult case for me was an 18-month-old girl. She came into my clinic without eating and drinking for weeks because she was vomiting anything she ate. I did a bedside ultrasound. She had a massive spleen, massive liver. I could feel her lymph nodes, very enlarged. I was concerned this might be a form of lymphoma. Now, normally in Canada, what do? We order a CAT scan or an MRI. Well, 3 MRI machines in Gaza in September 2023, all of them have been bombed and destroyed. Okay, let's get a CAT scan. There were 5 machines in September 2023. 4 of them have been bombed, and the only one at the time that was left was at the European Gaza Hospital. It was missing a part for weeks. Where was that part coming from? Well, it needed permission from Israel. that machine's also not working. It's okay, I can't get imaging. Well, I can feel the lymph nodes. Why don't I just biopsy the lymph nodes? What does biopsy it? Send it to a lab. We'll have a pathologist read it. Well, those labs that it would be read, there were 2 in Gaza. Both of them have been bombed and destroyed. Both of the pathologists, the senior pathologists, the only doctors who could possibly read that biopsy, both of them have been killed. So, what if we even had a biopsy? What about people who have a cancer diagnosis already? Well, adults who had a cancer diagnosis went here, the Turkish Friendship Hospital. That hospital has been destroyed. So adults with cancer, no care for 6 months. What about children with cancer? Well, the bottom picture shows Rantisi Hospital. That's where kids with cancer got their cancer treatment. That has been destroyed. Well, then you say, well, they should just leave Gaza, right? Leave Gaza, maybe they'll get treatment in Jordan, maybe they'll get treatment in Egypt. Well, that's a problem. They can only leave through Rafah, and they need the permission of the World Health Organization, Egypt, and Israel to leave. And I have these statistics. I've looked at these even this morning. So, as of this morning, 57% of females and only 40% of males are granted permission to leave for medical reasons. So, this 18-month-old girl is waiting for Israel's permission to leave Gaza for diagnosis and treatment of a likely cancer, and she's got a less than 50% chance of being granted permission to leave. She is a victim of genocide. Now, this is the Al-Aqsa Hospital in the middle zone of Gaza. Here you see 2 brothers on the left-hand side. Those are 2 brothers who are now living at one of the doorways of Al-Aqsa Hospital. They've been displaced. There's also multiple tents on site at the hospital. In the hallways of the hospital, in the emergency room of the hospital, families have put up tarps because they have nowhere to live. They've been displaced literally to a hospital where they live. And it is in this context that I'm going to tell you about another young man that I saw in the emergency room. This hospital is in Deir al-Balah. It's close to the Central Park. That area has been extensively bombed. A young man, likely in his late teens, early 20s perhaps, was brought in, unconscious, with a traumatic brain injury. The right side of his skull, ear, half of his skull, completely blown off. Brain matter visible. This was not survivable. He was still breathing, still alive, technically, in the emergency room. And he was dropped on the floor of the emergency room around people who were internally displaced and people whose bed was a carpet on the floor of the emergency room. Now in Canada, what do we do in this situation? We find a room, we bring an imam or a priest, we allow the family to visit, we provide some analgesia or some medications to alleviate suffering. This is not possible. The best we could do, this young man ended up in a corner of a room with a curtain on one side of him, a wall on the other. He lay on the floor, awaiting his death in a puddle of his own blood and brain. And I tell you, that was as dignified as we could provide. I'm about 5 minutes. Sorry, I'm going over time. Sorry. September 2023. This picture would have been impossible. This didn't exist. Okay. Prior to October 2023, there were 3 cemeteries in Gaza. One of them was for foreign soldiers who had been killed in Gaza, and the other 2 were for Palestinians who had died. One of those cemeteries was bombed. And at the early part in October and November, people who had been killed were being trying to be buried if they had family members in the existing cemetery. But given the volume of people that were killed, additional cemeteries were created. You'll notice here, these graves are close to tents. This is in the same community that I showed earlier, the tent city. There are tents all around the cemetery. So people are living amongst the dead in conditions that themselves are barely living. In early March, about a week before I was there, Israel delivered 80 dead bodies, which were buried in a mass grave in part of this cemetery, and most of the bodies were unidentified. Many of you are hoping this picture doesn't show you what you think, but it does. This only shows about a quarter of the area where children are buried. Many of these graves have 3 or 4 children buried. One of the physicians who had been displaced from the north, he actually was running a hospital in the north, was displaced to the south. We met with him pretty much every day because he was living in the same place we were living. 3 of his 4 children are buried. He would go there every single day. He would weep. He'd come home. Now, most of these children were killed by bombs. Their small bodies literally crushed under the rubble. Neighbors, loved ones would dig for days. Now, many of you have seen this picture. I'm going to end the talk by talking about torture, because I saw extensive evidence when I was there. You've seen this picture. This is from February. An Israeli soldier interrogates a Palestinian man in Gaza. He has a bullet wound on his leg. Hands are bound. This soldier, in this picture, posted this photo to his social media. So overwhelmed with a sense of impunity that he thought it appropriate to post this picture. This photo is also well known. There's a woman in red in the middle of the picture, actually. Her name is Hadil, and she was held by Israel for 50 days. She's a married mother of 2, and she was actually nursing one of her children when she was captured. She explained when she was released that if she moved, they would beat her. She also said, on the 3rd day of being held, the soldiers dug a trench, put dozens of men and her inside the trench, told her they would bury her alive. She was blindfolded. She heard multiple gunshots. Several men had been shot in the head, and then she was released. Now, we've seen the reports of mass graves. Al Jazeera has reported it. The United Nations Human Rights Office has reported it. They've reported people being buried alive, summary executions, signs of torture. This is consistent with what I saw. This is a very common injury. I saw this. Anyone who had been captured by Israel, held hostage, and then released, had this. I don't think I saw a single person who was held hostage who did not have this. This essentially results from having your wrists bound very, very tight, okay, for a long period of time. This is a mild case. Most of the cases I saw were much, much worse than this. And I'll show you a case here, actually. This is much more typical. The wounds here are much deeper around the wrists. You can also see a wound on the back of the hand. I met and treated a man in Rafah with similar wounds to this. Okay? Full circumference of his wrist. At one point, I could see his wrist bones. The back of his hand had a 2-inch diameter lesion, so deep I could see the bones of his hand. He was requiring a skin graft for the back of his hand. I made a mistake that day when I saw it. I asked him, how did that happen? I shouldn't have asked. This I could explain. The circumferential wounds around his wrist, I can explain. But on the back of the hand, what happened, he had his ankles and his wrists bent. When he was moved, he would be picked up by his feet and dragged. So to protect his face, he would do this. His hand, the skin on the back of his hand, was torn off, and then he would be left there. And to protect his face against the ground, he would lie like this. He was like this for weeks, and so he had a huge lesion on the back of his hand and the skin graft. This is a face I commonly saw. Palestinian men, traumatized by torture. I met a man in Gaza who had worked as a physician. I'm intentionally leaving out some details, and this is not his picture. I have provided more specific details and photographs to the ICJ, but there would be no way for me to provide those specific details without identifying. So I'm telling you as much as I can. So this isn't his photograph, but I met him in Gaza. He was a physician who had worked in a hospital that came under siege from the Israeli military. The hospital was taken over by the military. He was ordered to leave. He pleaded to stay to take care of his patients. He was told at gunpoint to strip. He did. He stripped naked, and he was told to stand. So he stood. He was told to stand. So he did. He was told to stand. And for 2 days, he stood. He did not leave that spot for 2 days. He needed to urinate and defecate. He asked. He was told, do it there. So he urinated and defecated on the spot that he stood, knowing that if he did not follow instructions, would probably be shot. He's a diabetic. So for 2 days, he was standing without his insulin. He developed a pressure ulcer on his heel. Standing. That's the only reason I was involved in this. After 2 days of standing, he was told, do you want to see your patients? You can go ahead, you can see your patients. He was still naked. So at gunpoint, he went to see his patients. There's a part of this that makes this even worse. He's a pediatrician. He will never be able to work again. The trauma of that experience, I cannot imagine being able to work again. The injury on his foot was terrible. He'll need a skin graft on his foot. But that was not the worst injury he had. The psychological trauma that this man has experienced, I think, is unparalleled. That would be more paralyzing than any physical experience. So it was in that context that the International Criminal Court and International Court of Justice, investigating war crimes and investigating genocide, has asked physicians to provide testimony, which I've now done. I will be doing again in a couple of weeks' time. So I want to leave you with my motivation, because it's important that all of us, this is not a time for paralysis, this is a time for action. You have all heard silence is complicity. There's some debate about where this term comes from. I think probably it comes from John Stuart Mill's comment, which is, bad men need nothing more to compass their needs than that good men should look on and do nothing. The cost of an action in a genocide that continues unabated, unchallenged. So, whether you speak out in your university, whether you set up and attend an encampment, whether you phone your MP, sign a petition, whatever you do, whether you go to Gaza to advocate there, whatever it is you can do, recognize this is a moment in time, and if you don't act now, you never will. Thank you.